Sexual harassment in government health facilities appears to be normalized and following a pattern of male-on-female harassment. An assessment by the Ministry of Health shows two major categories of sexual harassment defined as hostile environment and quid pro quo harassment. While rolling out the pilot implementation of the sexual harassment guidelines in Western Uganda, we interacted with some health workers who have been sexually harassed. Most of them are not free to openly discuss this matter on camera, but this health worker, who has been in the profession since 1987, preferred to talk to us in confidence. She says harassment normally happens in schools while they train, but is also prevalent at the workplace.
Especially when we are still young, in our youth time, where we have just qualified, you are new, you find the doctors and most of the health workers male, you start working with them. As your night during cold hours, they come. They want to disturb you, to take you off from the duties.
She says sexual harassment is oftenly committed by superiors.
We used fear, because the moment you talk that so and so is sexual harassing me, they would not understand you. First of all, they would think maybe you are the one who is going there. And on the other hand, you would look at it and say, if I report, what image will my colleagues take? You have to keep quiet because you are fearing the community.
The health workers say many sexual harassment cases go unreported, and this is why.
I think our society, culture per se, there is still a lot of stigma attached to issues of sex.
They fear to report the people who have sexually abused them, or they fear to come up in police and courts of law to witness, and give testimonies and the like.
People are probably not aware they can report, and maybe they are not aware of where to report.
Instead of reporting, you keep quiet, keep reserved, and you fight it on your own.
While opening the training in Rukunjiri district, the resident district commissioner, Dan Kaguta, said the absence of a reporting and case handling mechanism for sexual harassment cases was the major problem in dealing with the vice.
We look at our laws. A person who reports such an issue, how safe is he or her? We also design a specific officer in police who can handle those issues.
Because those people are there, they can even decide to knock you on the road.
Data on sexual harassment in the country is still very scanty, but a study conducted by the Ministry of Health shows that 4 out of every 10 health workers suffer sexual harassment at their places of work. Now, this is a danger because it chokes service uptake and service delivery.
People are harassed at the workplace. They lose morale. They are less motivated to work. They are prone to making mistakes, to adhering to protocols, to adhering to service protocols, standard operating procedures. Because of that tension, they work under uneasiness, they lose interest, they begin to absent themselves. At times, the extremes even may leave.
Mugalu says they have worked with the Ministry of Public Service, Ministry of Health and district local governments for sustainability and ownership after the project winds up.
We are just giving it 1 quarter of implementation, that's basically 3 months of implementation. So between May and June, we shall be monitoring. Like I've indicated, we already have indicators we shall be using to track. We have shared indicators with the people I have trained. We have also developed action plans with them.
The policy has various ways of handling sexual harassment cases, including seeking legal redress. But Alisa Ebare, the Gender and Non-Discrimination Program Officer at Intrahealth, says sexual harassment cases tend to be difficult to prosecute.
Some of them are married, they don't want their husbands to hear about it, that they are being harassed at work. They don't want to lose both the job and the marriage. Others find no cooperation from the system itself, because some of them will come out and tell you that it is the HR who was harassing me. and it is the same HR to whom you're supposed to report. Putting a dividing line between sexual harassment as an indiscipline and sexual harassment as a criminal offense. That there is no clear-cut dividing line unless sexual harassment has escalated to a level, say, of sexual assault, rape or defilement. Many people tend to look at it as a crime as opposed to it as an indiscipline or a misconduct for which one would deserve a disciplinary action.
She, however, has advice for those willing to report such cases.
Keep records, those WhatsApp messages, those SMSs, those emails, those nude pictures, different actions that are done to them should be kept for someone to be able to prove their claim.
For every regional referral hospital and district local government they visited, a focal point person was elected to ease follow-up.
This will help in reducing distance for them to report to me. But those are the channels from health facility to us. And then also we shall be investigating and submitting into the committee for further discussion.
By creating a sexual harassment response policy that is clear, respects complaints and is implemented fairly and consistently, organizations can begin to change culture around workplace sexual harassment. Walter Mwesigye, NTV.